Hey everyone, so I was sitting at my desk this afternoon, scrolling through LinkedIn, and I kept seeing people post about their experiences at the JPM conference in San Francisco last week. So I decided to make a video to talk about our experience at the conference, talk about the event we were given the opportunity to sponsor, and also talk about liability challenges facing digital health companies within this space. So now, if you've never heard of this conference before, every year JP Morgan puts on this healthcare conference in San Francisco where companies from around the world and all across the healthcare landscape, whether you're a startup or you're already well established, gives you the opportunity to come and meet with other industry experts and professionals, and also gives you the opportunity to come and meet other investors in the space. Now, the event we got to sponsor is called the Health 2.0 Venture Connect series, and at this event, 15 digital health companies were given the opportunity to go up on stage, pitch their companies and their platforms to a room full of investors as they seek to raise funding for their seed rounds and even their Series A rounds. Now, on the topic of digital health companies, I wanted to bring up some different liability challenges that they face as it relates to medical malpractice claims, HIPAA fines and regulations, and any other expensive litigation costs that are associated with these events. Now, when we work with our digital health clients, we generally give a few considerations to them to think about that would really help overall decrease their risk and exposure. Now, I wanted to give you a few of these considerations to think about. And the first consideration is to look at your client contracts, and more importantly, how this client contract addresses your exposure to things such as bodily injury, outage, or a breach of PHI if there were to be a failure of your technology. So for an example, let's say you're a digital health company and you're hosting some sort of data analytics platform and you're providing data for physicians. Look in your contract and look at the language. The language is key and really affects your risk and exposure. Now, let's say your contract can either say your data is providing info just for suggestions, or your data is providing a way to tell the doctor how to facilitate care to a patient. The difference in those two sentences is great when it comes to the different risk and exposures that could relate with a claim. So, look at your client contracts, look at the language, and make sure you know what the language is for your services, because that will greatly reduce your risk and exposure. Now, the second consideration now is to look at your critical vendor contracts, and more importantly, how that contract transfers risk away from your company. Now, more than likely, as a digital health company, you house some sort of PHI in your system. And let's say you're using Amazon Web Services to house this personal data. Look at that contract and figure out, make sure you know what happens if there is to be a breach of PHI as a result of a failure of AWS's technology. If this breach is because of their fault, you need to know who is liable to pay the financial risk associated with that. Now, a lot of times when we work with our digital health clients, we look at these contracts and AWS is assuming none of that risk if it is their fault. So you need to look at your contract with your critical vendor, whoever it may be, and understand who is assuming that financial risk and who is essentially footing the bill if there's going to be a failure of technology. You'd probably be surprised once you look at that contract and see that these massive companies that you're working with are actually housing no risk at all, and all the risk is going to be on your own specific company. Now, the third consideration we like to give after looking at your client contracts and your critical vendor contracts is to look at your insurance policies in place. Now, once you've looked at these contracts, you should have some sort of idea of what kind of financial risk sits on your balance sheet. So what is the cost that you're going to be liable to pay if there were to be a claim? That's what I mean by saying that. So look at your insurance policies and make sure that you know that your policies will pick up and will trigger if a claim is to be filed for any sort of a breach of PHI. Maybe it's a medical malpractice or any other thing such as that. Make sure you know your policies well and understand that you could be fully covered. And if you're not, work with your broker to figure out a plan to make sure that you are fully covered. So I hope this video was a little informational If you have any questions or would like to learn more, feel free to reach out to us. And if these videos are helpful, let me know and we'll start making more. So thanks for watching.